to Tino Show Forum. My name is Tino Ojinunga. Today I've got this guest here, this interesting and brilliant guest with me, who would, along with me, discuss the health issues we face in Nigeria. I've got health advisor, Tega Notoma. You're welcome to Tino Show.
Thank you.
Next to Tega, I'm sure we've got this famous face, Mr. Femi Okutubo. You're welcome to Tino Show.
Thank you.
And thirdly, my guest is Mr. Kunle Balogun. You're welcome
Thank you
to Tino Show Forum. So today we'd like to talk about the health situation in Nigeria. What do you think is going on wrong? Are we Africans in diaspora supporting the health department enough or not? The growth.
Well, there's no doubt about it that there are problems with the health situation in Nigeria in terms of unnecessary deaths. You also notice that health is not a cheap commodity in Nigeria. Though you only need to visit a place like maybe the state hospitals or the general hospitals to see the level of health care in the country, which is really, really appalling. In terms of answering your direct question as whether the diaspora are doing enough, at the moment I wouldn't say we're doing enough. That is not to say that we're not making some efforts, because for example I know of Dr. Femi Okutubo, for example, who among other people have led missions down to Nigeria. He's doing in fact a great good work in terms of healthcare delivery, especially as far as the delivery of babies is concerned, even in terms of even the taking care of people generally is concerned. I know people like Mansac, for example, have done things. There are probably some other organizations as well that have organized missions to various parts of the country. But I think what we really need is to have something that is actually collective and that is more coordinated, so that you don't have different people running different programs all at the different times, which may which may conflict with one another.
Okay, thank you. So what you're talking about basically is that we need maybe a solid organization that would notice every effort.
Not necessarily an organization in that regard. I think what we need is, well, obviously it needs to go through somebody so that at least it's coordinated. So for example, maybe if things are happening in Lagos State, for example, maybe naturally I will expect anything happening to probably the Lagos State Ministry of Health should know about it, so that what anybody is doing is complementing what the state government is doing.
And it will be recorded as well.
And it will be recorded as well, so that even if two different people from two different parts of the world call and say that they want to do something in Oshodi, for example, the Lagos State Ministry of Health will be in a position to say that, okay, no, in fact, we've had X number of programs in Oshodi already. Can we go and do something in Akomojo? So that at least that way the impact of whatever is happening is felt and it's not lopsided.
Oh, that's wonderful. That's good. Tega, what would you like to say to that?
Yeah, I think I very much agree with what he's just mentioned about organizations coming together. I do know about the MANSAC, which is more to do with the doctors. And we also have the Nigerian Nurses Association, which is very much got to do with the nurses in the diaspora, and us coming together as well to see what we can do with our colleagues back home in Nigeria to help the situation. Yes, we do understand and we know that there are lots of health crises going on there in terms of the manpower resources, in terms of the financial resources to run the different health services we have there. We do take those things on board, and we in the diaspora, we're very much coming together to see what we can do to help to make things better back home.
So, normally these problems, these crises that occur within the health department in Nigeria, for instance, who can we really blame this problem on, or who can we associate this problem, with? Is it the fault of the government? Is it malpractice, within the organization, the health organization, or is it just negligence, or what?
Well, I think It's a combination of all of those. If we want to start in terms of the resources that they have, I don't think there's enough finances pumped into the health sector in Nigeria. Hence, there is they don't have enough equipment to work with. They don't have enough drugs to share amongst the patients that they see. If you look at the manpower resources also, there's not enough nurses, not enough doctors, not enough midwives around to help see these patients that comes to them. Also, even the few that they have there have now come to realize that they are better off working internationally. So a lot of the nurses, a lot of the doctors and nurses and midwives, they've left the country to come down to the United Kingdom, to go down to United States of America and even to South Africa, because they get better paid there. So it's a combination of everything put together. Even the ones that have been trained, following their formal training, they do not get a continuous development to keep them up to date with the evidence out there to improve their practice. So again, looking at that, because there's no formal continuous training going on, obviously some of them that have been trained for 25 years, they have practicing based on what they know 25 years ago, whereas things have really changed in the health sector. So it's a combination of everything put together.
That's brilliant. Well, how do you think we Africans in diaspora can make a difference to that, to the appalling situation within the health service for as at now? I do know that when we're talking about inadequate medical equipment, that's there. We can also talk about importation of fake drugs that do come in daily from India and China. That's really happening. It's been happening for a very long time. And it's not really helping patients. If you administer a fake drug into a patient and leave the patient for some time, the patient will lose his or her life. And we have to work towards that, a problem, because that is a main problem in Nigeria, either we like it or not. People are less privileged, they're poor, they cannot afford to buy quality medication. And if that happens, they will now think of buying something poorly or something outdated or something that isn't genuine, and that really harms. Do you believe that, Tega?
I think the problem lies in the doorstep of the government, because if there's a government without a sound health policy, without people to administer these health policies, any policy you can think of, the policy is bound to fail. And I believe the people, Nigerians in diaspora, no matter how much they try, if there's no sound bond for them to lay on them, it goes to a waste. So I would like to know how much effort, how much effect my effort is going to get on the people. If there's no sound, no good policy for me to work with, there's nothing for me to do. I'd rather have my money somewhere.
I understand that.
Than any other putting it in somewhere that I know that all my effort will go in vain. So everything lays back to the government policies and.
I know. Can I? Sorry, Femi.
I probably agree with that to an extent, but I think I also will take a slightly different view, because it's so easy that many a times when things go wrong, we always point towards government. Now, the reality is that yes, to an extent that is correct, but in reality, it's not just about the government alone. There are roles which individuals themselves are playing. For example, you can imagine in a hospital, for example, where staff are stealing the syringes, going to go and resell to private people. That is not government. People would probably steal the thing and resell back to the patients who are meant to use these things. That is not government. People are not prepared to queue up to take their place on the queue. They don't mind tipping someone so that they can get to the front of the queue or not even have to queue at all. So all that is not government. So the point I'm really trying to make is that the blame is in the hands of both government and more the case even the people, the followers, because at the end of the day, every little action we take has an impact on the macro picture.
That's true.
For your relaxation, AC, 24 hours electricity, good customer service, exclusive cuisine, Africa and intercontinental dishes, jacuzzi, bar, nightclub, places to hire for meetings and conference hall. Come to Gordon Hotel. And for your extra limousine service at a reasonable cost, come to Gordon Hotel. Hello, Hello, Mr. Jacobs. How are you? So how are you? I'm fine. This is the place to be. 165 Sapele Road, Benin City, Edo State, Nigeria.
I understand that, but there's one thing we have to bear in mind, and that is the end, the receiver of every effort that goes into the system. The recipients will be the government, and they are the ones that would underpin all the support we are giving to the health department. Like Kunle said, Tega said, we all said, it's nice to support the improvements going on in our country, but what provision has the government put in place for us when we, come back to deliver our, assistance or this implementation? I do know that there's no point in pointing fingers to the government only, but to back that up as well. Like Tega was talking about Nurses and Doctors Association. I think if we have that solid, defined department back home, okay, we will be able to give all our support through that, okay, and by giving everything through that department, this will be a way of improving, the health department. Don't you think so, Femi?
It sounds good theoretically.
Sorry, instead of just believing that, people are, although we know people of the country are doing things wrong, we like to boycott the quality of things and go for cheap things that will endanger people's life. For instance, we're talking about cheap drugs, illegal drugs, and all that stuff. We know that's not the government's fault. But at the same time, if we in diaspora now buy new medical equipment for them, buy latest drugs for them to be administered and all that stuff, we cannot go directly to these people without getting through to the government to get the assistance. But that's why I'm asking, what is this association doing? If we've got this Nurses and Doctors Association in Nigeria, for instance, who would realize and understand that we Africans in diaspora can assist within that medical field with the little medical knowledge we've got within that medical field, then I believe that would be a way forward. Does that make sense to you? You look a little bit puzzled.
Yeah,
I honestly
because
don't know why.
You see, there's one or two things you've said in there which I don't necessarily agree with.
Please tell
now,
us.
For example,
you never agree with anything I say for the benefit of the tape. Never agree.
You see, the reality is that you just made a statement that you have to do certain things, and you have to go through government. I actually disagree with that. Now, that is not necessarily. It doesn't necessarily mean that that's the right way to do things.
Okay.
But in fact, you probably find out that sometimes when you need to do certain things, you're better off not even going to government.
I wish I could do a lot of things without the help of the government. I honestly would.
And the reality of the situation in Nigeria today is that in fact every household has become a local government in its own. If you go to a house now, they've got their own generator, so which is an alternative to PHCN or whatever it's called.
Yeah.
They've got their own borehole, which is a substitute to the water corporation. They have to make they have to get their cars, because there may not be public transport. They store as much fuel as they can at home.
Yeah.
And so but I'm not necessarily saying that that's the way things should be. But in reality as well, it's not uncommon that, because if you don't know the system very well, you could easily be frustrated out of the system.